cortisone injection today. For the aspiration, I like to have the patient lying in a supine position like this. We're going to wash the alcohol swab there. And we're going to use the ultrasound to help localize the fluid collection, since sometimes the fluid can be hard to get all the pockets of the fluid out. So if we look up at the monitor here, the femoral bone is here, and the black is fluid within the knee. So there's a large effusion. And now if you look back at the knee here, I'm going to spray in line with the ultrasound. Cold spray, okay, Elaine? No last name for identifying factors. All right, so nice and cold there on the skin. I've got my syringe with an 18 gauge needle all set to go. Okay, a little bit of pain here when it goes through this one layer, okay, Elaine? Sorry, yeah, sorry about that. So if you look up at the monitor now, the white longitudinal structure is, of course, the needle. The needle is right now in a little bit of tissue, so I'm going to pull it back. And now it probably doesn't hurt as much anymore. Is that true, Elaine? Does it still hurt a lot? It still hurts, okay. All right, so now I'm going to aspirate. You can see the black area is shrinking, but because I have ultrasound, I can actually keep redirecting the needle into the middle portion of that fluid collection. If the needle tip is going to go into the tissue at all, like right there, it'll stop aspirating because it's sucking up tissue. But now if I pull back, you can see the needle coming back. Now I'm in the middle of that black zone again, and therefore I know I'm making like micromillimeter adjustments, and I can get as much of that fluid out as possible. Okay, so now I've gotten the fluid out. And now you can take a look at the knee again, okay, Leash? So now with the same needle in place, I'm going to unscrew the hub of the needle. I've gotten out a good amount of synovial fluid. Put that aside, and I've pre-positioned and prepared the corticosteroid injection with the local anesthetic. And with the needle in place, I can put this back on. I don't usually put the ultrasound back on at this point, but we can for demonstration purposes. I can pull the, now show the screen. There's the needle tip is right there. I pull back a little bit, and now I'm injecting the corticosteroid. And you go back to the knee now. And we're all done. So I'm going to pull the needle out. All set. You can turn that on.